Hello, everybody, and welcome to the Water Research Foundation webcast on participatory ergonomics to reduce injuries in wastewater and water employees. My name is Katie Henderson. I'm a research manager here at the Water Research Foundation, and I will be moderating today's webcast. I'm going to start out first with just a few housekeeping items. First, you are welcome to submit questions through the question box at any time. We'll save time at the end for Q&A. If we don't get through all of those questions, the research team has agreed to follow up with individual questions via email. Slides and a recording of the webcast will be available on our website almost immediately following the webcast. If you would like PDH certification, please send an email to Michelle Suazo following the webcast. And then also, if you wouldn't mind hanging on just for a minute after the webcast finishes, we have a survey at the end, and your input helps us make sure that we're delivering high-quality webcasts for you. So just to go over, this is how you will submit a question. You can ask a question, press send. We will see that, and the questions will be answered at the end. And then this is also how you can download your own copy of the presentation. So you click on that little arrow, and you'll see the file for download. All right, so I'm going to turn it over to our speakers. First, we will hear from Elise Condi. Elise Condi is the National Ergonomics Practice Director for BSI. She's an experienced professional in the areas of occupational safety, ergonomics, and injury management. Following her presentation, we'll also hear from Rachel Murphy, who is the Director of Engineering for Contra Costa Water District. Elise, over to you.
Thank you, Katie. So good morning or afternoon to everybody, depending on where you are. As Katie mentioned, my name's Elise Condi. I'm the lead for the research team that conducted this research for the Water Research Foundation. Rachel and I are not necessarily taking turns today. We're kind of tag teaming. So I'm going to get Rachel to chime in and share her experiences as a research participant when it makes sense to do so. So Rachel's the Director of Engineering at Contra Costa Water District, and she worked with Sarah Bogner, who couldn't be here today, unfortunately, to lead the team at Contra Costa Water District for the purposes of this research study. So Rachel, maybe we can kick things off by having you say hi and tell us a little bit about your organization, and then I'll talk a little bit about where I'm from and what BSI does.
Sure, great. Good morning and good afternoon. As Elise mentioned, Contra Costa Water District was involved from kind of conception of this project, and we're a water district in Northern California. We have about 300 employees. And those employees are involved in both the conveyance along our untreated water system. We have 48 miles of open canal. We have 4 reservoirs, the largest of which is our Los Vaqueros Reservoir, a variety of pipelines, reservoirs, and pump stations, and we serve about 500,000 customers.
Thanks, Rachel. And I'm from BSI, which stands for the British Standards Institution. I'm from Australia originally, but I am also based in California. We are a global consulting firm, and we do everything under the sun relating to environmental health and safety. But I lead a team of about 20 ergonomists across the United States, doing ergonomics in pretty much every industry you can conceive. And as the National Ergonomics Practice Director, I head up that team. Yeah, it's a pleasure to do what I do. So let me now tell you a little bit about the project itself. So Contra Costa Water District first commenced discussions with the Water Research Foundation to conduct this funded research, and BSI responded to the Water Research Foundation, letting them know we had the expertise to help facilitate the project. And we had 5 utilities agree to take part. So thank you to these agencies for providing their time and effort and expertise. We had, in addition to Contra Costa Water District, Columbus Waterworks in Columbus, Georgia, East Bay Municipal Utility District in Oakland, Los Angeles Department of Water and Power, and San Francisco Public Utilities Commission. So they've all contributed time and effort and data to helping us evaluate the effectiveness of this approach in the water and wastewater industry. So this research project looks at the concept of participatory ergonomics. So this is the concept that workers are the experts in their work. They may not necessarily be experts in ergonomics when they first join a participatory ergonomics program, but if we give them the right tools, time, and training, they're going to be able to see the same things the ergonomist sees in terms of hazards and risks from an ergonomic standpoint or an injury standpoint. And they're going to be even better than the ergonomist is usually at actually coming up with potential solutions to the problems that they found. Participatory ergonomics is not the ergonomist or the facilitator telling everybody what to do or how to do it. And it's not just giving people training in ergonomics. It's about actually taking that training and using it to solve problems in a way that's very much directed by the people who do the work. And we're going to get a much better sense of what that looks like as we go through the webinar today. So first we're going to talk about what you should do when you're trying to implement a participatory ergonomics program in your workplace. You're going to start with designing your actual program, and we're going to talk about what current peer-reviewed literature says about what your program should look like, and we're also going to talk a little bit about, can everybody still hear me? Someone just said they've lost the audio. Just checking. We can hear me. Okay, great. Let's talk a little bit about what the evidence says and how you apply that. Okay, so program design. You need to think about your existing organizational structure, how many different business units you have, what the hierarchy looks like, how complicated that is, reporting lines, direct and indirect. You need to think about what your current organizational culture looks like. So are people generally pretty open about sharing? Are they willing to try new things? Is there good support from management and very senior management for a program like this? And then what do your existing systems look like? So if people are going to report hazards, how do they do that? If they're going to buy stuff, what does that look like? What kind of training do people have already? Like how fluent are they around ergonomic hazard recognition and applying the hierarchy of controls? Because all of these things are going to come to bear on how ambitious and how in-depth your program is going to be. So Rachel, maybe you can tell us a little bit about how these things looked at Contra Costa Water District and what sort of decisions you made about how you involve your employees in this program.
Sure. Excuse me. So the way we structured our participatory ergonomics team was to have a team that was led by our safety manager, and then I was involved as a management representative, excuse me, really to help ensure progress and help eliminate hurdles that maybe were being encountered along the way. And then we developed a team that was really a cross-section of employees across the organization, both field and supervisory staff from various work groups that have traditionally had maybe a higher injury rate. And so that cross-section team really started to meet, and we built on an already successful model that we had with our safety committee. We've been working on improving our safety culture for about 8 or 9 years, and we have a very robust safety committee that already met to address or meets to address safety-related issues. And so this was really supplementary to that process. All of our employees get very basic ergonomics trainings, and so having the help of a consultant as we got going was certainly important. But yeah, generally utilizing an already existing process that was robust for us, which was made up of management and supervisors, this approach to ergonomics was really complementary to some system that we were already building at the district.
Great, thanks, Rachel. Okay, so when you're thinking about what your program is going to look like, you think about your structure and your existing processes and your culture. There is a really excellent paper by a lady named Sue Hignett from 2002 that talks about the different dimensions of an ergonomics program. And here they are on the slide. I'm going to talk about each of these in a little bit more detail. So first is the location of decision-making power. So this is talking about who's actually going to approve the way you structure your program, the sort of solutions you choose to buy and implement, and how that decision-making power is going to interface with the participants in your program, which also relates to the mix of participants you have. So are you going to have very senior managers take part? Are you going to have more middle managers and supervisors? What kind of employees are you going to involve? What's your ratio going to be of like management staff to employees? This is all going to shape the structure and tone and the sort of problems that you choose to focus on as part of this program. Remit is looking at what sort of decisions they're allowed to make. Are there going to be really big, juicy problems that no one's been able to solve for ages? Or are you going to more like tinker around the edges and solve some problems that are a little bit easier to solve because you know that's more within the boundaries of your ambition? The role of the ergonomic specialist pertains to how involved you ask an ergonomist to be. We learned from this project that there's definitely a benefit to having the ergonomist involved, making sure that the team chooses to focus on appropriate problems, that the controls or solutions that they're choosing to implement actually help address the problem they were trying to solve in the first place, that they're staying on track, give guidance on how to effectively implement their solutions and things like that. And the degree to which this person is hands-on is really going to depend on some of the things we were talking about before. And also the degree of expertise you have in-house and the degree to which your existing supporting processes like purchasing and communications and consultation and stuff are well established. The nature of worker involvement. So, are they just going to provide input on what sort of problems they think you should solve, the kind of solutions that you think they should try? Are they going to be really involved in the implementation of those solutions and the sourcing of those solutions? Or is that going to be done more by, say, the safety team or the ergonomist? Focus and scope. So are we going to focus on problems that pertain to the entire organization? Are we going to look at things that pertain to just one business unit? Are we going to do a mix of each? That depends in part on the complexity of your organization and the participants that you have in your group. Level of influence, again, is this talking about just a single business unit within an organization, or are you going to have representatives from across the whole organization providing input into the sort of problems you solve and the manner in which you solve them? Requirement talks about whether or not it's going to be mandatory or voluntary. And in some cases, people do need to be voluntold to take part, at least at the outset. And then the permanence of the initiative is, are you going to use this program to just solve some specific problems that you have? Or is this going to be an ongoing thing like an ergonomic subcommittee under your existing safety committee or, a standing agenda item on your safety committee when the program is properly up and running. Okay, so thinking about all of those different dimensions of a participatory ergonomics program, these are the decisions you need to make in relation to those dimensions if you're looking to do something like this at your work. So first, make sure you've actually got the support of your management to do something like this. How senior are your management representatives going to be that take part? And you can see in Rachel and Contra Costa Water's example, Rachel's at director level, they had fairly senior management taking part in this, as a regular thing. Like she was actually taking part in all the training and the meetings and supporting the team that way. Some of the other utilities had more like the health and safety manager or the director of regulatory compliance taking part, and the more senior managers would come in and show their support and ask about how things were going, but didn't necessarily take part in all the regular training and meetings. Some utilities had just a select team taking part, so like their distribution department or their pipelines crew. In the case of Contra Costa Water, they had representatives from several different divisions participate. Same with Columbus Waterworks. They had representatives from pretty much every department at the utility. You need to decide how big a change you want this team to be able to make. So, in the case of Contra Costa Water and some of the other utilities, they were looking at being able to recommend major capital expenditures in the forms of new equipment. Some others were more deciding to focus on smaller scale changes like modified hand tools and equipment and things like that. Some of them did a mix of both. They all had an external facilitator, of course, in the shape of me, but that was because this was a funded research project with a defined structure. You need to decide what level of ergonomic expertise you have and whether that person can also double duty as like a facilitator and a trainer, whether you need a couple of different people working together to help pull this off, whether you need to bring somebody in to help facilitate as an external facilitator. You also need to decide whether you've got enough people volunteering to take part in something like this, or whether you're going to tell people, no, we really need your help. You need to start coming to these meetings. And hopefully, as they get started, they'll find that this is actually worth taking part in and will start to participate a little more willingly. And decide if it's something you're going to use to solve a set of problems that have been sticking around for ages and you just haven't been able to solve them, or whether this is going to become a standing thing that goes on for a period of time. It's also worth noting here that if you do decide to engage in an initiative like this, one incentive you can offer is to have your teams submit an entry to the Ergo Cup at the Applied Ergonomics Conference, which takes place in March every year. And they're looking for employee-driven teams to present their solution and compete for a prize. And if you tell your teams, you can go to Orlando or wherever it's being held that year, that's often an incentive enough to get them to take part. But of course, you need to budget for that and make sure you actually can send them to Orlando if they get accepted to compete. So keep that in mind. So these are all of the things you need to consider when you're planning your program. And then when it comes to actually executing your program, there are some practical considerations to make. And there are definitely some things we have learned from this funded research project that we want to share with you today so that you can learn from our experience. Okay, and I'm going to get Rachel to talk a little bit about her experience with all of these in just a little bit. So we have learned that even if you only get part of the way towards having this program actually fully implemented, you can still get results. Like, we had a couple of utilities that didn't get to implement quite as many solutions as they would have liked, or didn't get to fully train an employee-driven team. Yet they were still able to produce usable data. They were still able to have employees identify solutions to some of their ergonomics problems and implement them to the extent where they were at least able to test them out and show that employees found those solutions to be beneficial at reducing the amount of exertion they experienced when they did those jobs, and they were able to measure a reduction in the number of ergonomic risks involved in that job with the introduction of that solution compared to what it looked like before they started using that solution. It's really important to make sure that you're ready to do something like this before you start out. It's more important to be ready and to do this than to not attempt to do it at all, or to say you're going to do it and then not actually execute and follow up on the recommendations that employees provide you. And to be able to do this, senior management really needs to understand how much time is going to be needed for employees and managers to take part. You're going to need to make sure you have a way for employees and managers to consult with each other on the problems that they find and how they're going to solve them. If you don't have an existing safety committee or some other mechanism of consultation before starting this program, it's probably worth thinking about how you're going to do that before you then go on to something like a participatory ergonomics program. You need to make sure you have enough managers and supervisors and employees with time and availability to take part, because otherwise people are going to get pulled into those competing priorities. It's going to be hard to get them to meetings. It's going to be hard to have them take the time to source and test solutions, and it's going to threaten the long-term viability of your program. You need to understand the existing level of trust between employees and management, which is not to say that if you don't have a high level of trust, you can't do a program like this, but you just need to recognize where you are right now. And if you've had initiatives in the past where there's been a lot of talk and not a lot of action, you need to also recognize that there may be a degree of suspicion amongst your employee population about your ability to follow through. And that's where this follow through will be really important if you decide to go ahead and do something like this, because otherwise it can really threaten your overall culture and level of trust between employees and managers. And to that, your ability to sustain this over a long period of time, if that's what you intend to do, is important to understand before you get started. You may wish to just create a problem list of 5 or 6 problems and solve that to begin with, rather than commit to a long-term sustaining initiative if you're not confident in your ability to do so. Because this was a research project, we collected a lot of data around the program. So we collected data on the number of risks resolved using a defined checklist. And we also collected data on ratings of perceived exertion by body part before and after a solution was implemented. Now, you may not wish to go to that extent for data collection for your program that's not going to revolve around a research project, but we would still recommend collecting some sort of data to help you track your progress over time and whether things are actually producing an objective result or whether a return to the drawing board is required. So Rachel, on those dimensions, what would you add around Contra Costa Water District's experience and the sorts of things you feel like you specifically learned getting started in executing this program?
Sure. I would say that at the outset, we had a very high level of awareness about the project. We had a high level of support from our management on the project, so that did help getting resources and employees participating in the project, whereas some of the other participating agencies maybe didn't have that level of engagement. We are used to employee-driven solutions through our experience with the safety committee. So I think our employees do feel empowered to solve safety-related problems. So engaging on this project to solve particular ergonomic problems was, I think, more natural for our employees. My involvement in the project really was to help eliminate hurdles, help with purchasing, and kind of encouraging the team to move forward with some of those purchases, even if we weren't sure yet whether it was going to solve the ergonomic problems at hand. We had to be accepting that we may try some solutions that didn't work or didn't fully work, and that was okay because we were getting closer to potential solutions. So I would say those,
yes, totally agree.
And I think, those I would say were kind of keys for success for us.
Yeah, and that's actually a really important point you're making, Rachel. And I think in my role as a facilitator, I think that's one of the most valuable contributions I had to make, was reassuring teams that this was an exercise in experimentation as much as anything else. Employees are allowed to recommend just solutions at a conceptual level, and the facilitator's role is to help execute them. And my role is to help pick them up when they try something and it doesn't work, to reassure them that that's not failure, that's just a way of ruling out a solution as something that didn't work, so that you can then move on to finding something that actually did work. So, assuming you've made your assessment and worked out where you're at, had a good pulse on where you may encounter hurdles to success, and really ready yourself to deal with those as they arise, you're able to start actually pulling a team together and implementing your participatory ergonomics program. So you've defined how you're going to measure the success of your program. Management are all on board. You've worked out who's going to take part, both from a management and an employee standpoint. You've decided how big the problems are going to be that you're going to try and solve. You've worked out who's going to help train your team and get them started. And yes, thank you. Someone got my blue stubs reference. Thank you, Jose. And you've worked out how you're going to communicate to the organization that that's what you're doing and that it's going to be amazing and everyone's going to love it. And you're finally going to fix those gnarly problems in ergonomics that no one has been able to solve yet. Then you can finally tell your team that they are the chosen ones, or they are the successful volunteers, and they're going to take part, and they're going to enter the Ergo Cup, and they're going to be winners, and it's going to be amazing. So you want to firstly make sure that your management team actively assert their commitment to this project. Now, this looked different at different utilities. I'm going to get Rachel to talk about her utilities experience in a minute. At Columbus Waterworks, they had their very senior management team join a sandwich lunch at one of the first training sessions and ask them to talk about what they've learned so far, what they think they're going to work on, how are they liking it, and then every so often you check in with them in that very one-to-one, face-to-face sort of style, and that FaceTime really seemed to make a big difference to how genuinely the team felt management commitment to the project. Make sure the team really understand why they're there. A lot of the time, to begin with, they'll confuse it with more like a general safety committee type thing. They need to understand that they have the power to make recommendations and to try different things, and make sure they understand how you're going to measure the success of what the team do, whether that's measuring changes in exertion scores, changes in risk, the number of solutions they try, or something else. Make sure they've got visibility to that. And then once you've got them all trained up and they're starting to think about which issues they want to work on and try to improve, get them to get started with something as a test. So this should be something that's pretty easy to fix, to show them that there is a process that can work if they apply it properly, and also help test the organization's general ability to implement new solutions, because we are focusing predominantly on engineering solutions in a program like this. And so that usually involves things like design changes or purchasing, and you want to make sure the organization as a whole is actually able to get that stuff like out in the field and not have it just sitting around in a warehouse somewhere or not even showing up in the first place. So Rachel, maybe you can tell us a little bit about your utilities means of showing management commitment, and maybe talk about a couple of like your quick win issues that you worked on.
Sure. So like I mentioned previously, the way we demonstrated management commitment is we had a couple of managers involved in the initial training and in the monthly meetings throughout the project. And, we recognize that at least 70% of our injuries are sprains and strains. And so we were very mobilized that something needed to be done and a new approach to looking at some of these jobs. Some of those ergonomic risks were more difficult to solve than others, but we did have a balance of those more challenging tasks as well as some quick wins, as Elise mentioned. We looked at improved ways for how we were handling plywood. One of our bigger risk areas is traversing slopes for slope protection and covering those slopes with tarps and sandbags. And just going to a smaller size sandbag, while sounds like a pretty straightforward change, it just wasn't something that occurred to us to implement until we were talking about some of these ergonomic challenges.
Great. Thank you, Rachel. And I can say, as a facilitator, I saw that as your team picked off these couple of easy issues to solve, like the penny dropped, and they were like, oh yeah, awesome. Like I can actually change things and fix them and make them better. I have the power and the support to do it. Now I'm going to try the things that are a bit harder that I've always wanted to fix but never really been able to, because I haven't had the means to do it before, and now with this program I do. Okay, I've got a question here. Did you work with any loss prevention folks during their project? So I'm an external consultant, David from Narragansett Bay Commission. So we didn't have any loss prevention folks, so to speak, but I'm a certified professional ergonomist, and I was there to help make sure that the team worked on issues that actually had some sort of ergonomic basis to them to begin with, and gave them training, which we're going to talk about in a second. You can see that slide up here, and guide them through the project. So having loss prevention people kind of would have been a bit of a duplication of effort with me as the external facilitator already there. Okay, so team training. Every utilities team got the same training, and it was broken into 3 different sessions, and they got each training about a month apart. It depended on the individual utility schedule, but they all eventually got the same training. So in the first training session, they got an introduction to what ergonomics is, how to identify ergonomic risk factors of force, repetition, awkward and sustained postures, contact stress, and vibration. And we gave them some water and wastewater specific examples to help them train their ergo eyes and be able to actually think about the jobs they did and where injury risk resides in the sort of work that they do. We taught them how to apply the hierarchy of controls, particularly around substitution, elimination, and engineering controls, because we really wanted them to focus on those higher order control measures rather than get too caught up in administrative and PPE controls, which aren't as reliable and typically aren't as effective at managing injury risk. We sent them out into the field after those 3 topics and got them to start taking photos and videos of the different jobs they could think of where these risk factors existed. And they brought these videos and photos back into the training room, and we did observation training together to say, okay, what are you seeing here? You know, this person is throwing a sandbag down a hill. Where do you see force? Where do you see repetition? Where do you see awkward postures? And helping them see things through that ergonomics lens and helping them describe what they saw. Because once they understand the problem, they have the power to solve it. And we'd start talking about conceptually different controls they could apply to the problem to address the different risk factors that they found. We taught them a little bit about how to develop a project plan and execute a project plan. That's really important because once they identify their solution, they have to work out how they're actually going to implement it. And taking a project management approach to that really helps them take things through to that execution stage. How to manage different stakeholders, make a persuasive argument, how to make a business case around whether your solution is going to generate a return on investment. This is where we start getting into the 3rd training session. We used the Washington State Department of Labor Ergonomics ROI calculator to help people make their business case for a given solution. So helping them work out the payback time and things like that. We taught them how to use the different data collection tools to actually evaluate the effectiveness of their solution. So they had a exertion survey tool that they'd give different users to use before and after implementing a solution. And they also had the Washington State Department and Labor Hazard and Caution Checklist, or a modified version of that. And we made sure they understood how to collect all the data that we needed for the research part of this project. And then we taught them how to sustain the program over time. So, you know, I went away. Eventually, the research component of my project was done, but the hope was that these utilities would sustain the program over time. And we taught them how to roll this process back into an existing safety committee or something similar. Like I said, my role in this was as a facilitator. Excuse me. I was there primarily to provide ergonomics expertise as a board-certified professional ergonomist and someone with a lot of experience in developing and implementing solutions in industrial environments. So I also helped people like Rachel and Sarah and their contemporaries at the other utilities work out how they were going to kick off their program and work out who they were going to involve and how to secure their involvement. I was there to provide those 3 training sessions to all of the participants to help with solution design, and you're going to see some things like the Sandbags sled and the UV buoy that I was able to help provide input into. Actually, well, I didn't design the buoy, but I helped them make sure it was actually going to work, and to keep everybody on track, particularly for the research component of this and hassling everybody to collect their data. And then helping them wrap things up at the end and talking to them about how they'd integrate this back into their existing safety programs. Rachel and Sarah and I and the folks at the other utilities still stay in touch and talk about how things are working out, and from time to time they'll come to me with questions or ask me to take another look at something, and I'm quite happy to help in that capacity as expert facilitator. So I kept my degree of involvement fairly consistent across all 5 utilities for the purposes of the research study part of this project. Looking back, some utilities would have benefited more from a more hands-on approach than I was able to provide, because they weren't as ready, they weren't as well-resourced. Their existing EHS processes, especially around employee consultation and participation, weren't as robust. So it would have benefited them to have me do a little bit more legwork at the start, getting those things in place so that when they moved onto the participatory ergonomics part of this, they were really ready to exploit it to its fullest extent and really get the most out of a program like this. I would say in the case of Rachel and Sarah and Contra Costa Water District, they already had some pretty well-established consultative processes. They were pretty ready to take part, and so they were able to really get a lot out of their participation in the research project. Rachel, anything else you'd want to add about your experience having this done with a facilitator?
The only other thing I would add, where in addition to the kind of baseline trainings and facilitation that we had, when we did get stuck, we were able to, using GoPro cameras, we would take a video of a task that was particularly challenging to solve. We were able to share that with Elise, and so that she could see the what we're grappling with, and then we could, even if we weren't all around the same table together, brainstorm some solutions. So we found that to be a pretty useful way to, and even with some of the other utilities, to kind of look at some of these ergonomic challenges.
Great. Thanks, Rachel. Of course, of true love never ran smooth, and that's true for this project as well. Pretty much every team got a little bit stuck at some point, and I'm going to talk about some of the common hurdles that pretty much every utility went through at one point or another in this 2-year project. So, common hurdles. It's a long project, especially for a safety-related kind of initiative. And so what we found for some of the utilities, particularly those that were already a little stretched for resources or had a lot of competing initiatives, it was hard to maintain that level of visible management commitment over the duration of the entire project. And that would then have a knock-on effect to the engagement and involvement of the team and actually getting them to take part and do their bit. Some utilities have lots of other competing initiatives or a lot of other programs happening at the same time, whether it was in the EHS space or more generally. And so then the participatory ergonomics team would be competing for resources and time and space and money to execute the participatory ergonomics program, particularly as it relates to identifying and implementing solutions. One utility in particular had a lot of staff turnover, particularly in the EH&S team, who played a very big role in actually carrying the program day to day and being hands-on. And that was a challenge to assure continuity in that particular utility. A couple had difficulties navigating their purchasing processes and working out how to actually buy stuff and get it out to the field, which, when we're talking about engineering controls and trying different equipment, made it hard. Frustration when solutions didn't work. We talked about that a little bit before. I'm going to let Rachel relate her experience in a minute. Getting a little too aspirational with the solutions they tried to implement. So one utility really wanted to buy a lot of very large earth-moving equipment, like front-end loaders and stuff like that, but they weren't resourced or in a place organizationally to be able to do that, and then the team got frustrated and it was hard to keep them engaged and motivated. A couple of utilities had difficulty getting their solutions out to the field and didn't get to the point where they were actually able to evaluate those solutions for the purposes of research. I know some of them did actually get rolled out and implemented after the fact, but you won't see them in the final report when you have a chance to read it. And as I mentioned, some of them really needed more hands-on assistance from someone like me than the research study scope was able to provide. And so if they'd been able to have more dedicated time from me, they may have been able to produce more solutions actually getting implemented and subsequently more results for the purposes of the study. What would you add to that, Rachel? What were your experiences in terms of encountering some of these hurdles?
Well, I would say certainly competing initiatives. We have our fair share of competing initiatives. But I would say the biggest light bulb moment, I think, for us in implementing solutions was the coaching you gave us as far as, even if the identified solution doesn't eliminate 100% of all of the ergonomic risks, if you only eliminate 50% of them with a particular solution, we still eliminated a lot and made some headway. And that reminder was, kept the team engaged and kept us moving forward and not getting discouraged if we didn't eliminate or completely mitigate all of the identified risk related to a particular task.
Yes, absolutely. And I mean, we did a lot of work looking at valve turning and different things we could try to reduce the amount of exertion required to open and close and exercise valves. And I think we came away at the end of the project learning that it was okay to have a toolkit to work on your different valves and have a selection of solutions to try, and be okay with the fact that there's no one universally perfect solution that works for every valve out there that you need to work on at a given point in time. Great, thanks for that, Rachel. Okay, so this was a research study. We did produce some data and some results, and I want to share them with you now. So we had 5 utilities take part in this study. 4 or 5 returned usable data that we could actually compare before and after with. Like I said, we collected data around the ratings of perceived exertions that employees reported before and after a solution was tried. So they'd rate by body part how hard they felt they were working out of 10. And before and after, we're comparing those ratings out of 10 by body part, and we saw a global reduction in those ratings. We also counted up the number of risks using the Washington State Department of Labor caution and hazard checklists, or a modified version of that. It was a little difficult to collect some follow-up data relating to the number, the count of risks before and after a solution was implemented. Now, we put this down to the fact that they were already happy with the solution, so they didn't see a need to evaluate it again. It's like I said, it's good. It's like, I don't know why you want to know anything more about it. But, for where we did get risk assessments returned after a solution was implemented, we saw reductions in risk between 23 and 57%. We did paired t-tests on the ratings of perceived exertion data, and we saw statistically significant changes for the shoulder, back, and legs, but not the forearm or wrist and hand. And we are getting very quickly to the end of the hour, but I want to take some time to show you some of the solutions that these teams developed, because they are very cool. You're going to say some of them aren't that original, but keep in mind that this was what the group of employees said would help reduce their perceived exertion and their ergonomic risk. They actually got implemented. They weren't being used prior to this program being implemented, and they probably tried other stuff before that either didn't get sustained or dropped off on the long term. So for all these utilities taking part, it's important to monitor how these solutions are getting used in the long term and make sure they continue to sustain, and that there's not a need to revisit these problems and see what else they can try. And then I'll focus on some of the ones that Rachel and her team implemented. There is a handbook that's going to come out with the final research report for this that showcases all of the solutions I've got on these slides. So if we don't get through them all, definitely make sure you avail yourself of the handbook and have a look. And if you want to, reach out to me or Rachel to discuss any of them, you're certainly more than welcome to. So Rachel, do you want to talk us through this one? This is the valve can lid lifter.
Sure. Lid lifting or valve can lid lifting is an area where we've had stress strain injuries before. The lids get stuck, which result in elbow, shoulder, and back injuries. We have a long-term solution of replacing out these lids with a different material. On the interim, we needed something else. So the team did some internet research and found a bottle jack lid lifter online. When it arrived, it didn't have the right dimensions to work for our particular situation, which led to the team kind of fabricating their own. So now, similar to what Elise said earlier about having a toolkit, employees will try the manual lid lifter. If the lid's stuck, they'll try the bottle jack, and then there are other solutions if that still doesn't produce the desired results. But this was something that we found particularly successful.
And this was another great example of one where you had to revisit the problem several times before you really found a solution that worked. I remember hearing about, the key bit that inserted into the lid bending and breaking, and some lids still getting stuck. Like it took a bit of effort to finally find something that worked.
Yes, that's correct.
Yeah, great. Thanks, Rachel. And then let's take a look at Sandbags.
Sure. I mean, this is another area, I mentioned it earlier. We have each winter various areas where we have to go out and cover up slides. It results in lugging tarps and sandbags and kind of throwing them down the slope and getting them set into place. So there's injuries from slips and trips and sprains and strains. So as I mentioned, one of the first and early ideas was to just use smaller sandbags. And so, yes, we had to use a few more of them, but still overall it was an improvement. The next thing we tackled was how to transport those up and down the slope itself. The first thing we tried was a flat bottom boat with a winch to lower it up and down the slope. And later we found and purchased a snowmobile sled that we could use for the same type of purpose. And again, these were ideas that the ergonomic team, they were doing internet research, they'd try something, it didn't work quite right, they'd try something else.
Great, thank you. And then I think we'll look at the UV buoy and the weed raking problem, and then we'll pause there and go to some questions. So you can, like I said, have a look at the handbook to see all these solutions and all the other ones that the other utilities came up with, which are all fantastic, but I want to leave us some time for questions. So take us away, Rachel. Tell us about this one, because I think it's one of the best ones.
Oh, thanks. Sure. So we do have about 50 miles of open canal. So a very labor-intensive task that we have is weed raking of various screens and siphons and those sorts of things at our canal facilities. And there's a picture on the screen of one of our facilities where an employee is just continuing to rake the material that's accumulating there. Long history of back and shoulder strains. We have a long-term solution. We probably have 16 different locations where we would construct at over $1 million a piece a more automated screen to keep it clean. But so in the interim, looking at different solutions. And so we pilot tested the use, and you'll see it's kind of hard to see on the screen. It's actually like a pontoon boat with UV lights on the bottom. And we pilot tested that on a portion of the canal to basically kill the weeds, because one of our issues is weeds growing in the accumulated sediment at the bottom of the canal. That was successful, and we're currently pilot testing a larger stretch of our canal just to assess the scalability and see how quickly we would be able to treat a longer segment of our canal. And so far, the results look promising.
Awesome. Thank you, Rachel. I think it's important for everybody to note too, as you look at these solutions and look at the handbook, it's a great way to start getting your own team thinking about different things they could try. But I would make sure you really understand the problem you're trying to solve and have some degree of confidence that this solution is actually going to solve your specific problem before you go out and just try to apply it to your situation, because that doesn't always guarantee success. So make sure you really evaluate your own particular ergonomic circumstances and business processes and operational imperatives before you go ahead and implement a solution, rather than just listing one you've seen here because it looks good. I hope that makes sense. Okay, Katie, interested to hear what questions the group may have.
Sounds great. Thank you so much for your presentation, Elise, and for your input as well, Rachel. I wanted to let listeners know that the handbook and the accompanying research report will be available on the Water Research Foundation website soon. They're still undergoing final publication review, but it should be done very quickly. We will let all of the registered attendees of the webcast know when those resources have been posted online, so you can download them. So to start out, I want to ask just a couple of quick questions with the few minutes that we have. And that is, a lot of questions have come in about buy-in and the level of buy-in from employees and how to get them on board. And one person asked whether you noticed any differences in the level of buy-in based on age or how long they'd worked at the utility or other factors.
Rachel, maybe you can share your perspective first, and then I can talk to what I saw at the other water utilities.
Sure. I would say from our perspective, I didn't notice a significant difference in buy-in based on age or tenure. I would say some of our more tenured employees had been here long enough to know what some of these really challenging ergonomic tasks are. And so were able to help us identify maybe what were some of the tasks we needed to really focus on. But as far as buying into trying some of the solutions, we didn't have a noticeable difference between some of our less tenured versus some of our more tenured employees.
Yeah, and Rachel, I'd agree with you there, especially for Contra Costa Water District. I would say you didn't see so much of a difference in like age or tenure, so much as if you already had some difficulties with your consultative processes already or the general organizational climate. More tenured employees would be more likely to just tell you what they actually thought about that than some of the less tenured employees. Where if things are a little more organizationally healthy, more tenured employees were really good at being able to tell you what they tried before that hadn't worked, how to get things done in the organization. Like they were really good at being able to draw on that experience and help make the program more effective overall. It was just more if everybody was already dissatisfied or didn't have faith that the program was going to succeed, those more tenured employees are going to be the ones who are going to tell you all about that.
Sounds good. One person asked about whether you gathered actual injury reduction data resulting from some of these interventions as part of this research project.
Sure. So we did try to collect them to look at change over time. And you're going to see this discussed in the research report. Because we're dealing with musculoskeletal disorders, which have a pretty long lead time to actually manifest themselves to begin with, and then a pretty long time to actually resolve. It takes a long time to see changes in injury and days away from work rates manifest themselves in something like this. So it may be valuable to do some follow-up with these groups a little later after the conclusion of the research to see how much change actually happened. It will probably take more like let's say 3 to 4 years to see an actual significant difference in MSD rates specifically, and we only had 2 years. So even if we had really collected it and followed it up over time, I wouldn't have expected to be able to attribute any of the changes to this intervention specifically. And that's why we chose to look more at ratings of perceived exertion and account of ergonomic risks, because to the research team, they were a more direct and more sensitive measure of success than a lagging indicator like DART rates.
Great. Well, I'm afraid we are out of time. Everyone who submitted questions that we didn't get to, the researchers will get back to you via email, and you can continue a dialogue that way. I want to thank you all for tuning in today, and to remind you, please, to take that short survey after we wrap up here, and also to stay tuned for a notice about the handbook and the report being posted online on our website, which should be very soon. And I want to thank you again for your participation and wish you a great rest of your day.